Hey, I'm Dr. Rich. So in this video, I'm going to show you how I adjust sore spots on dentures.
Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
So in this video, I'm going to go over the tools I use to adjust sore spots, both the hand pieces and the burrs, the drill bit, basically. And you can use anything from, a dental slow speed handpiece. You can use an electric lab handpiece that's available pretty inexpensively on eBay or Amazon. I'll leave links to it. Or you could even go on Amazon or Harbor Freight to buy a Dremel tool that comes with the different burrs, the different drill bits that you can use, both for adjusting your denture and other projects around the house. But before we even get into the actual tool and the adjusting, which is the easy part of it, the tough part of adjusting sore spots is figuring out where the sore spot is and knowing where to adjust it on the denture so that it relieves, so adjusting it will relieve the sore spot. So there's two tools that I use to help me with that. One is Dr. Thompson's color transfer sticks, and the other is pressure indicating paste. So I'll go over both of those, how I use them, and in which situations I'll use one or the other. So I'll leave timestamps down below to show you, so you can jump to those areas. But I highly recommend watching the whole video so you can get a great overview of the entire process. And it's also going to be helpful for me with the YouTube algorithm. And I'll explain how I use them, and then I'll even show you some footage of me actually using them on a patient's denture. Next, here's a close-up of the Dr. Thompson's color transfer sticks. Okay, so here's the Dr. Thompson's color sanitary transfer applicators, made by Great Plains Dental Products out of Kansas. So basically, old-timey product. It's just a wooden stick with a little ink on the end of it. So the idea behind this is if you can actually see where the sore spot is in the mouth, you take this stick, dip it in some water, there you can see the ink, and that'll leave the ink. So you basically dip it, go into the person's mouth, and I like to just circle the sore spot where it is and insert the denture, press the denture into place for a minute, pull it out, and then the ink will transfer from around the sore spot to the denture, and then you know where to adjust. So now I'm going to show you how I use this material on a immediate denture case. So this is the immediate denture. This is the day after it was inserted, so you could see the extraction sockets still look fairly fresh in the mouth, but they have a bunch of sore spots. There's a particularly nasty one there, and on both sides, roughly in the same area. So again, I'm going to take my the Thompson stick, dip it in some water, and just circle the sore spots that I see. Now I circle them instead of pressing exactly on the sore spot, just for patient comfort. And then once I do that, I dry the inside of the denture, put it in, and you can see where the ink transfers over. Next, I'll take my burr and my slow speed handpiece and just lightly remove a little bit of material. It tends to be, on dentures, it always tends to be around the edges where, because of the shape of the gum, the denture kind of overhangs it and has to engage some undercut. So that helps it stay in place, but sometimes too much pressure is uncomfortable for the person. So you need to adjust this very lightly, take a little bit of material off at a time, and then we go back in, try it again. If you take off too much material at one time, then the denture could end up being loose. And since this is immediate denture, it's going to be loose anyway. So now the person's still complaining about a little bit more pain there. It's still felt a little tight on the left-hand side, right there where my finger is. And he'll even point me to right where he's feeling, and that way, that's where I know. So again, I'm going to circle it. And I also like to keep my finger in that spot so that I know roughly where it is. So in addition to where the ink shows it, my finger lets me know that's where it was too. And again, I'll just adjust it some more with my burr. And again, lightly, I'd rather take a bunch off, a little bit off a few times to get the person comfortable than just take a lot off at once. Here is a close-up of the pressure indicating paste. And these are both available. You can find them on Amazon, on eBay. I mean, everything in the world's available on Amazon nowadays. So these are really great if you know where the sore spot is. If you don't know where the sore spot is, then I like to use pressure indicating paste. So this is the name brand Mizzy pressure indicating paste. This is basically just a creamy white paste. I had a professor in dental school who told me he made his own version using Crisco and cornstarch. I just buy this stuff. But basically you take this, you spread it on the inside of the denture, make a nice thin layer, put it inside the denture, put the denture into the person's mouth, have them bite down a few times. I also like to press up on the denture with my fingers to put some pressure on it. Take it out, and then where the material was pressed away, that's where it's the tightest, that's where it's rubbing, and that's the spot you adjust. So here's the same case. This is that immediate denture just a week or two later. And as you can see, the extraction sites have healed up nicely, but the person is complaining of some sore spots, a little bit of pain and discomfort in the upper right-hand side. So I'm just looking around, see if I notice any sore spots. I'm feeling around with my fingers, asking him if anything hurts. I did notice a little piece of bone getting pushed up out of the socket of the upper right canine there. So let me just remove that with my forceps, but that wasn't what was causing him any trouble. But I did notice a little bit of redness there by the muscle attachments, the frenums on the upper right hand side, right there where my finger is, and then also a little bit further back there might have been a little red spot. So this time around I'm going to use the pressure indicating paste since it's a more generalized area. So we're going to dry the inside of the denture off and put a nice coat of the pressure indicating paste on the inside of the denture. So I'm not going to fill up the entire denture since I know the general vicinity of where these spots are, where the sore spots, where the discomfort's coming from. I'm only going to do that area to do it. And you want a nice even coat, so that nice thin even coat all around it. And once that's on there, then we put the denture back in the person's mouth and we press on it. Sometimes I'll have them bite down, move their mouth around. In this case, I'm using my fingers, pushing down. I'm going to grab their lips and cheeks, basically the border molding movements, and try to move things around, see if I can see any spots where it could be pressing. I didn't really see anything right in those sections where he's complaining, so let's do that again. Putting it back in, pushing, wiggling it around, tugging on his lips and cheeks. And again, let's see if we have a better idea of where the spots are. And so now I see a couple places, so I will take my carbide burr and my slow speed handpiece and just lightly adjust them. And again, I don't want to take off a lot of material. I want to just take a little bit off at a time. I'd rather remove material 4 or 5 times than do it once and then take too much off and the denture ends up being too loose. Once I remove a little bit, go back in and just spread some more of the pressure indicating paste around. Again, a nice thin, even coat all around, and denture will go back in the mouth, and we'll do the same thing. Move things around, tug on his lips and cheeks. I'll ask the person too, does that feel better? Does it need a little bit more adjusting? And just go by feel. So I think he still felt a little bit of something, so I'm going to remove a little bit, but he said we were really close. So I'm just going to take a little bit. Again, I'd rather leave him with more material, and then I can always remove it at another visit, as long as he doesn't mind coming back in for an adjustment. But adjustment visits are generally quick. So another little spot there, and then we're ready to go. So now I just take my non-woven gauze 2x2s to remove the pressure indicating paste. I find these work the best because they don't fall apart like a tissue or a paper towel would be. So I'll leave a link to them down in the description below. So if you want to order some from Amazon, I find them very helpful to use around the house. My wife uses them to help take her makeup off every night too. For a sore spot where the person is complaining of some pressure, a little bit of pain, but I look and I don't see a sore spot, that's when I use the pressure indicating paste, because that can show me those spots without me having to visually find it and circle it. So that's when I'll typically use the pressure indicating paste versus the color transfer stick. For a case of an immediate denture where the person just had a bunch of teeth pulled out and we're fitting the immediate denture in that same day or the next day, they still have a lot of open wounds. So I like using the color transfer sticks in those situations because it just leaves a little ink on their gums. It doesn't have this paste. That's the one downside to the pressure indicating paste. Somewhat messy to remove out from inside the denture and inside the mouth. The kit of the paste actually comes comes with some remover that you just spray on a gauze 2x2 and wipe it out. Helps you remove it from the inside of the denture. But again, in an immediate case, which I will show you, this is what my go-to first thing I use, because usually in an immediate situation too, first time person's wearing a denture, so they will have sore spots that you can visually identify and see. And if you're trying this at home, you may need to enlist a family member to help to look around and circle it so you don't mix it up. Try not to let the gums, the cheeks, or when you do paint this on there, don't lick that area with your tongue. Don't let your lips or cheeks press up against it because it's going to smear and get all over the place. Let's go over the equipment that I like to use. Okay, so typically what I use to adjust is my slow speed air-driven handpiece on the dental chair, and I usually typically use a carbide burr. Just spins. So whenever there's a spot, so for instance, let's say a person came in and it was digging in right here, so there you can see where the ink had left a spot. You just take my burr and lightly grind it away just so it disappears, so you don't see it anymore. And there you have it. That's basically all you got to do. You adjust the sore spot. Now the key to adjusting sore spots is do a little bit at a time. It's very easy to remove material from a denture. To add it back in and have it look good, it's got to go back to the lab. That's not something you're going to really be able to do at home. So a little bit at a time. Try it in again. See how it, for certain situations, if it feels better, great. You just wait a few days, see how it goes. If you're still feeling some pressure, again, just circle the area with the color transfer applicator and adjust it some more until it feels better. That's if you see a sore spot. If you don't see a sore spot, again, you just paint the pressure indicating paste in that area, put it in, wear it, take it out, and you'll see exactly where to adjust. Now on the inside, we call this part of the denture, the part of the denture that rests against the gums, we call that the intaglio surface. Dentists call that the intaglio surface. I typically, once I adjust it with my carbide burr, I don't polish it or anything. I just leave it like that. That gives it a little bit more grip, especially if the person's going to use some denture adhesive. And on the lowers, everybody uses denture adhesive. If there's a spot, let's say on the edge, that's digging in, say this is too deep, and you adjust that, and again, don't take too much off, but if you adjust it and say you roughen up the outside of the denture, that's the part that you can potentially feel with your tongue. I don't know if it's coming across on the video. I'm going to try on the camera. I'm trying to make sure you can see it in the light, but it's a little rough there. So what you can do, just get some polishers. So these are just some rubber polishers with different grits of material in there. So again, these are my fancy ones that I buy from the dental supply company. You can buy similar versions on Amazon or eBay. And basically it comes in a coarse, which is the black one, medium, which is green, and then yellow is the fine one. So I typically don't use the coarse one because I find that leaves coarser than my handpiece, than the burr. So I'll take the medium one and I'll just lightly go over that. And that smooths it down nice. So that just gets rid of the roughness, and then to polish it, just use the light one, the yellow one. And again, light touch. So, and that's generally the best you can get at home. You can also, at the office, I have a big grinding wheel and a big lab lathe, and I could put a rag wheel on that, and I can polish that up with some pumice, wet pumice on a rag wheel. You can get that nice and really shiny, and I'll even have another rag wheel that I can use with some material called acryluster, which is a plastic acrylic polish type of stuff, and that works pretty well. So you can find that stuff online. And so I typically use the carbide burr. You can also use a stone. I just find I've been using a carbide burr since dental school, so for 30 years I've been using this, and that's just the one I'm most used to using. These work as well. These, though, they will tend to get plugged up with trimmings after a while. So same thing with the carbide burrs, but for these you could just use a brass, you can get a brass bristle brush. Looks like a fancy toothbrush either at Harbor Freight, again, Amazon, and to brush out any of the little bits of plastic that are stuck in there. All right, I hope you guys found this video helpful and informative. Please consider subscribing to the channel. I try to post new videos once a week. And also hit that thumbs up button. That really helps me out a lot with the YouTube algorithm. Doesn't cost you guys a dime, but it helps expand the reach of my videos. The more people that subscribe, the more people that watch my videos, the more people that give me the little thumbs up, the more people YouTube in turn will show it to. So again, thank you so much for watching, everybody. See you guys in the next video.